In 1987, when I was only a couple months old, I was given only a 50-50 chance of living. Why? I had contracted the meningitis disease. Fast forward 31 years later, on February 1st, 2018, at 23:15 or 11:15 p.m., my brother would take his final breath here on Earth. Why? He contracted bacterial meningitis. My life changed that day forward. Not only have I made it a mission to bring awareness to this disease that not many people know about, but my family as well. Many people who contract the disease mistake their signs and symptoms with the flu. Even physicians mistakenly do the same. According to the CDC, on average, bacterial meningitis causes about 4,100 cases and 500 deaths in the United States each year, between 2003 and 2007. There are three types of meningitis: viral, bacterial, and fungal. But for the purpose of today's speech, I will speak mainly on the bacterial meningitis. In today's speech, we will discuss my three main points of bacterial meningitis that include what is and how is meningitis spread, who's at risk and ways to prevent it from getting it, and the symptoms and complications you can face. At the end of my speech, I hope the audience walks away with informative information about this deadly disease. What is meningitis? According to the Centers of Disease Control and Prevention, meningitis is an inflammation or swelling of the protective membranes covering the brain and spinal cord, known collectively as meninges. Bacterial meningitis can be life-threatening because of the inflammation proximity to the brain and spinal cord. Therefore, the condition is classified as a medical emergency. Bacterial meningitis occurs when the bacteria gets into the bloodstream and travels to your brain and spinal cord to start an infection. This disease is contagious and can be spread through close personal contact, such as coughing, sneezing, and kissing. How is bacterial meningitis diagnosed? A medical history and physical exam are done when you are at the hospital, including a number of diagnostic tests. Some of the tests include your blood culture, a CT or MRI scanning of the head to show if there is a swelling or inflammation. For a definitive diagnosis, doctors will do a lumbar puncture, also known as a spinal tap. The doctor injects an area of the lower back with an anesthetic, a drug that keeps you from feeling anything while the procedure is going on. The doctor then slips a needle between two bones in the spine to get a small sample of spinal fluid. The fluid is normally clear, so if it appears cloudy and has white blood cells in it, you may have meningitis. After you are diagnosed, or sometimes before results come back, treatment is needed. Treatment is intravenous antibiotics and sometimes corticosteroids. If in fact you are diagnosed with the disease, those who came in contact with the individual need to be tested and given antibiotics to be safe and clear that they may have not gotten the disease as well. Who's at risk? Those that are more likely at risk are infants and children due to their weak immune system, young people living in dorms, barracks, or close quarters, and older adults that have a compromised immune system. However, I myself had it, and anyone can get it. A couple of steps to preventing bacterial meningitis include washing your hands, which prevents the spread of germs, practicing good hygiene by avoiding sharing drinks, food, lip balms, toothbrushes, and anything that belongs to you that do not share. Staying healthy by getting enough rest, exercising, eating healthy will help you maintain a good immune system. Covering your mouth when you need to cough or sneeze. An easy method is coughing into the elbow crease. Immunizations are key to preventing bacterial meningitis. Getting an immunization for the disease will help prevent an epidemic of great proportion. The meningococcal vaccine is recommended to kids in the United States when they are 11 or 12 years old, followed by a booster at 16. Effective January 1st, 2014, State Law Senate Bill 62 requires that students who will be under the age of 22 on their first day of class at a public, private, or independent institution of higher education in Texas provide proof of immunization for bacterial meningitis. The vaccination or booster must have been received during the 5 years prior to enrollment and at least 10 days before the start of classes. Finally, the symptoms of bacterial meningitis include a fever that will not break, confusion, vomiting, a rash, a severe headache that some describe as the worst headache of their life, seizures, sensitivity to light, or the main symptom is neck stiffness. Though these symptoms are relatable to the flu, if you experience any of the symptoms, please go to the emergency room. You risk severe complication the longer you wait to get diagnosed. You can suffer from blindness, hearing loss, memory difficulty, brain damage, loss of limbs, shock, or even death. Today we went over the bacterial meningitis is. Not many people know what this disease is or what it can do if not treated. First, we spoke about the three main topics of what and how meningitis is spread, getting diagnosed and treated for. Secondly, we went over who is at risk and ways to prevent contracting the disease. And finally, symptoms and complications that come with bacterial meningitis. I would like to end the speech with a little bit of words. If you or any of your loved ones have any of the symptoms, please go to the emergency room. It's better to be safe than sorry. Whether it be viral, bacterial, or fungal meningitis, all types of meningitis matter, and they need to be talked about more, and everyone needs to be educated on it. Thank you. I want to show you guys a form, and what it is it's just the signs and symptoms of meningitis. You have the headaches, the neck, cold hands and feet, the vomiting, you get the rash on your chest. And I want to talk a little bit about my brother. He passed due to this disease, and he went in with all the symptoms above. By the time the doctors did get to him, or did give him anything, it was a little too late. So I want to bring awareness to this disease because it's important to me and my family, and I feel like we owe it to him. So especially with flu season coming up, if you have any of these symptoms, just go. It doesn't hurt. But every year on April 24th is Meningitis Awareness Day, and we did it last year. Was our first year. And here are the pictures. It's just that we promised to bring awareness to him, and we promised to be his voice, since my brother did go in and they would not listen to his signs or symptoms, and they just waved it off as the flu. So we promised that we be his voice. So that's our mission, to speak up for him. But again, I said April 24th is Meningitis Day, and I'm pretty sure this year we'll be doing it again. So just please get checked. I really don't want another family to go through this, because it really hurts. It hurts. But these are the shirts we also had made for him. So if you can, just informing others will help. You tell 10 people, they tell another 10 people. We get the word out, and more people know about this disease. Thank you for listening.